All right, here we go.
Okay. To adjust the hip, first you need to find out which hip needs to be adjusted. So you have your patient bend their knees, and do a bridge where you raise your bottom up off the bed and then go back down and then straighten out your legs. And then what you need to do is assess which leg is longer. I like to put my thumbs right over the ankle bones so that I can see which one is uneven. And right now, David's right leg is about half of my thumb longer than his left leg. So the right leg is what needs to be adjusted because the right hip is tilted forward. So to adjust it, you have them bend their leg, and the idea is to keep the lower leg relaxed because it's just the hip joint that we're working on. And you're going to use your shoulder as something for them to push against. What they're going to be doing is using their hamstring muscles to push against your shoulder. So what you want to do is you want to flex the hip joint to get it at about a 90-degree angle. And then you're going to have them push into you for 5 seconds, just holding it. Okay, ready? Go ahead. 1, 2, 3, 4, 5. And relax. And then you flex the hip joint again, going a little past 90 degrees. Maybe about, you don't want to like get into resistance, but more than 90 degrees. And then have them do it again. Push 1, 2, 3, 4, 5, and relax. And then you do it a third time, going as far as you can get their hip to flex without causing any pain or hitting resistance, and then do it again. Push against me. 1, 2, 3, 4, 5, and relax. And now you have them straighten out their legs, and then they're going to bend both legs, do a bridge, come back down, and stretch out. And you need to verify to make sure that their legs are equal distance, and David's is. If they were to still, like if this leg were still longer, you just do the whole procedure again. And usually the second time is enough to get them fully equal. Now sometimes what happens when the hip is rotated, it affects the pubic bone too. So I'm going to actually show you how to adjust the pubic bone as well. Both legs have to be bent. And what you do is you have them squeeze your hand for about 10 seconds. So they're just going to squeeze your fist. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And now you just spread their hips apart a little bit more, where they squeeze your hand and your elbow. Go ahead. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And then you open the hips even more, and they push against your hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And what that does, that resets the hip or the pubic bone. So only if they're having pubic bone pain does that need to be done. Just because their hip is out doesn't mean their pubic bone is out. But if they're having pain there, then you would want to adjust that as well. And that's how you reset it. If you're by yourself and you need to adjust it and you don't have somebody to work, you can go ahead, David. Thank you for your help. You can do it yourself. So you'd have to figure out which leg is longer by putting your ankles together. Often it's the same leg, but sometimes it can be the opposite if both sides are unstable. And whichever one it is, mine are actually equal right now, so I don't really have a leg to adjust, but I'll just show you. What you would do then is to get your leg about 90 degrees, and then you would push against your hand instead. So you're still using the hamstring muscles, but you're pushing down into your hands. You would hold that for 5 seconds. Then you would raise the joint a little bit more so that you're more than 90 degrees. Hold for 5 seconds, relax, and then bring it up a third time and then that can help adjust it yourself if you're by yourself.